What's up, everyone? Modern Warrior Project here, and today we're tackling a serious but incredibly important topic. What happens to your body after significant radiation exposure from something such as a nuclear event? Now, I know this can sound scary, and it's a scenario none of us ever want to face. But knowledge is power, and understanding the potential effects on the human body is the first critical step in being prepared. This isn't about fear-mongering, it's about empowerment through education. By learning to recognize the earliest signs and symptoms, you dramatically increase your ability to respond effectively, protect yourself and your loved ones, and make informed decisions when every single second counts. Our goal here is to break down the medical science in a way that's easy to understand, so you know exactly what to look for. We're going to walk through the symptoms one by one, from the most immediate to those that might appear later. Think of this as a medical briefing for a worst-case scenario. The human body is remarkably resilient, and it sends out clear signals when it's in distress. Recognizing these signals early on is absolutely crucial. It allows you to prioritize actions and seek the right kind of help if it's available, as well as manage the situation with a clear head instead of panicking. In a crisis, panic is the enemy. Having a mental checklist of what to watch for can ground you and give you a sense of control in a seemingly uncontrollable situation. We're going to discuss the physiological responses your body might have, from your digestive system to your skin, and even your psychological state. Understanding the why behind these symptoms, what's happening on a cellular level, can help demystify the process and reinforce the importance of the immediate steps you need to take. This knowledge isn't just for you, it's for your family, your neighbors, your community. Being the person who knows what to do can make all the difference, so take a deep breath. We're going to go through this methodically and calmly. I want you to absorb this information not with fear, but with a focus on preparedness. The information we'll cover is based on decades of medical research and observation from events like Chernobyl and Fukushima. It's reliable, evidence-based knowledge that can equip you to face an unimaginable challenge. Remember, the first few hours and days after exposure are the most critical window for intervention and for mitigating long-term damage. Let's get into the first and often most immediate set of symptoms you need to be aware of. Nausea and vomiting are classic early signs of acute radiation syndrome, ARS. This is the prodromal stage. Symptoms can appear within minutes to hours depending on the radiation dose. Radiation damages the rapidly dividing cells lining your gastrointestinal tract. This triggers your brain's vomiting center, causing intense nausea and vomiting. The faster the onset, and the more severe the vomiting, the higher the radiation dose. Seek immediate medical attention if possible. Medical professionals can administer antiemetics to control vomiting and prevent dehydration. If medical care is unavailable, focus on safety and assessment. Get to a safe, sheltered location. Nausea and vomiting are the first red flags, signaling a serious medical event. Following closely behind nausea and vomiting, or sometimes occurring concurrently, is diarrhea. Just like the cells in your stomach lining, the cells that make up the walls of your small and large intestines are also in a constant state of rapid division and replacement. This makes them highly vulnerable to the damaging effects of ionizing radiation. When these cells are damaged or killed off, the intricate lining of your intestines, which is responsible for absorbing water and nutrients, begins to break down. This catastrophic failure of the intestinal barrier is what leads to the onset of diarrhea, which can develop within a few hours of a significant exposure. The severity of the diarrhea, much like the vomiting, is directly proportional to the radiation dose. In cases of high exposure, the diarrhea can be incredibly severe, frequent, and watery. In the most extreme cases, it can become bloody, a condition known as dysentery, as the intestinal walls become ulcerated and begin to slough off. This is a very grave sign, indicating that the gastrointestinal system has suffered massive, perhaps irreversible damage. This symptom is not just uncomfortable, it represents a profound and dangerous internal injury that is rapidly depleting the body of its essential fluids and electrolytes, like sodium and potassium. This leads us to the most immediate and critical danger associated with severe diarrhea: dehydration. Your body can lose a tremendous amount of fluid very quickly, leading to a state of hypovolemic shock. Symptoms of severe dehydration include a rapid, weak pulse, low blood pressure, dizziness or lightheadedness upon standing, dry mouth, and a significant decrease in urination. This condition can rapidly lead to kidney failure, cardiac arrhythmias, and loss of consciousness. Therefore, if diarrhea begins, Aggressive hydration becomes the single most important immediate treatment you can provide, especially if formal medical care is unavailable. If the person is conscious and not actively vomiting, they need to be sipping fluids constantly. The ideal fluid is an oral rehydration solution, which contains a specific balance of water, sugars, and salts to replace what's being lost. If you don't have pre-packaged solutions, you can make a basic one yourself with clean water, salt, and sugar. Plain water is better than nothing, but it doesn't replace the critical electrolytes. The message cannot be overstated: stay hydrated. This is a battle against time and fluid loss. Recognizing diarrhea as a sign of severe radiation injury and responding with immediate, aggressive rehydration can be a life-saving intervention while you await or seek professional medical care. Let's discuss skin burns or cutaneous radiation injury. This is cellular damage caused by radiation penetrating the skin, not like a thermal burn. Depending on the dose, it can manifest within hours or days. Initially, you might notice redness, like a mild sunburn called erythema. As the dose increases, redness can evolve into blisters, indicating a second-degree burn. Immediate steps: gently clean the area with lukewarm water and mild soap, avoiding scrubbing or popping blisters. Avoid creams or home remedies. Seek professional medical care. Self-treatment risks infection and scarring. Treat any injury with the seriousness it deserves. Profound fatigue is a classic sign of significant radiation exposure. This is an overwhelming exhaustion and weakness that can come on within hours or develop over days. Even simple tasks feel monumental. Radiation causes widespread cellular damage, and your body expends energy trying to repair it, draining your reserves. It's your body forcing you to conserve energy. The most important step is to rest and avoid physical exertion. Continue monitoring other symptoms closely, like nausea or fever. Tracking these associated symptoms will be valuable information for medical professionals. Rest, stay hydrated, and pay attention to your body. Hair loss, or alopecia, is a delayed effect of radiation exposure, typically starting 2 to 3 weeks after a significant event. Radiation targets rapidly dividing cells, including those in hair follicles, disrupting hair production. The extent of hair loss depends on the radiation dose. High doses can cause rapid and complete hair loss, affecting the scalp, eyebrows, and eyelashes. This visible sign indicates a medically significant radiation dose, confirming exposure. Hair loss isn't painful, but it signals damage to critical cells like those in bone marrow. Long-term medical monitoring is essential. Will it grow back? It depends on the dose. Regrowth is possible if follicles aren't permanently damaged, though texture or color may temporarily change. High doses can cause irreversible hair loss. Medical consultation is crucial for managing health and coping with the psychological impact. Let's discuss fever, a common sign your body is fighting something. In acute radiation syndrome, fever indicates your body's reaction to cell damage and inflammation. Monitor your temperature. A fever within hours could be the initial phase, while one appearing weeks later might signal a compromised immune system. Track your temperature and other symptoms. Seek immediate medical care if your temperature climbs above 101 degrees Fahrenheit, 38.3 degrees Celsius. Now let's talk neurological and vascular symptoms like dizziness and confusion. High radiation doses can profoundly affect your cardiovascular and central nervous systems. Dizziness or lightheadedness can occur due to a drop in blood pressure as radiation damages blood vessels. Confusion or disorientation often indicates a high radiation dose affecting the brain, potentially leading to cerebral edema. The onset can be rapid. If dizzy, sit or lie down. If confused, stay put. Having someone with you is life-saving. Guide those with these symptoms to safety, understanding they may not be rational. Dizziness and confusion are critical medical emergencies. Call for immediate medical help. Keep the person calm and lying down. Do not give them food or drink. Every second counts. Professional intervention is crucial. Internal bleeding is a hallmark of hematopoietic syndrome, often appearing weeks after significant radiation exposure. Radiation damages rapidly dividing cells, especially hematopoietic stem cells in bone marrow, which produce blood components. Damage reduces platelet production, leading to thrombocytopenia, a dangerously low platelet count. This impairs blood clotting, causing spontaneous bleeding throughout the body. Signs include petechiae, unexplained bruises, bleeding gums, nosebleeds, or blood and urine, stool. Unexplained bleeding after radiation exposure is a massive red flag, indicating severe bone marrow suppression. Immediate hospital care is crucial. Treatment involves platelet transfusions to restore clotting while the bone marrow recovers. This delicate phase requires specialist management in a hospital. Time is critical. Let's discuss respiratory symptoms that can occur after significant radiation exposure. This includes coughing, wheezing, or difficulty breathing. Radiation can damage the delicate tissues of your lungs, leading to inflammation and fluid buildup, known as radiation pneumonitis. This can develop weeks or months after exposure. Damage to the lungs' air sacs can cause shortness of breath and wheezing. These symptoms can escalate quickly and represent a critical medical emergency. Difficulty breathing is a red flag symptom. Ignoring these symptoms could lead to severe respiratory distress or long-term lung scarring. Seek immediate medical attention if you experience these issues after radiation exposure. Doctors can use imaging tests and provide supportive care and medication. Early intervention is key to preventing complications. Don't delay. Now, let's move on to one of the most profound and systemic effects of radiation exposure: the damage to your immune system. Your immune system is your body's personal military, a complex network of cells and organs that work tirelessly to protect you. Key to this defense are your white blood cells, which are produced in your bone marrow. Unfortunately, bone marrow is one of the most radiosensitive tissues in the body. High doses of radiation can essentially wipe out the stem cells in your marrow that create new blood cells, including white blood cells that fight bacteria and viruses. This leaves your body incredibly vulnerable. This suppression leads to increased susceptibility to all kinds of infections. A simple cold that a healthy person might fight off in a few days could escalate into severe pneumonia for someone with a compromised immune system. Minor cuts or scrapes that would normally heal without issue can become severely infected. Your body loses its ability to mount a proper defense, turning everyday germs into potentially life-threatening invaders. This state, known as immunosuppression, is a hallmark of significant radiation injury. It's a silent, invisible threat that makes every interaction with the outside world a potential risk. Because your internal defenses are down, proactive monitoring and preventative measures become absolutely crucial. In clinical settings, patients are often placed in protective isolation to minimize their exposure to pathogens. At home, this translates to meticulous hygiene. Frequent and thorough hand washing is a must. It also means actively avoiding contact with anyone who is sick, even if they just have a minor sniffle. You have to become your own best advocate for your health, creating a clean environment and being vigilant about signs of developing infection, such as fever, sore throat, or new cough. Long-term management of a compromised immune system requires close partnership with your medical team. Regular blood tests will be necessary to monitor your white blood cell counts and see how your bone marrow is recovering. If your counts are critically low, doctors may administer colony-stimulating factors, which help encourage bone marrow to produce new white blood cells more quickly. In the most severe cases, a bone marrow transplant may even be considered to replace the damaged cells entirely. The key takeaway is that radiation doesn't just cause immediate symptoms. It can fundamentally cripple your body's ability to protect itself, making ongoing medical care and vigilance essential. Finally, let's discuss the psychological impact of radiation exposure. The mental and emotional toll can be just as debilitating as physical symptoms. Experiencing a radiation event is incredibly traumatic. This can lead to acute stress disorder, anxiety, depression, and even PTSD. These are understandable human responses. Recognizing these is a critical step in dealing with them. If possible, seek professional help, but if unavailable, lean into your prep or support group by letting them know what you're struggling with. Simply bringing it out in the open can greatly mitigate the struggle. Don't try to tough it out alone. Make it a priority in your recovery plan. We've covered a lot of serious and frankly scary information today, from nausea and skin burns to the invisible damage done to your blood cells and your mental health. The key takeaway from all of this is the profound importance of early recognition and immediate medical intervention. The sooner you identify these symptoms and get professional help if available, the better the chances are for managing the effects of radiation exposure and improving your long-term prognosis. Time is absolutely critical. Hesitation can have severe consequences, so knowing these signs is your first and most powerful tool for protecting your health in such an extreme scenario. If you ever find yourself in a situation involving potential radiation exposure, remember these immediate steps. First, evacuate the area as quickly and safely as possible. Second, decontaminate by removing your outer layer of clothing and washing your skin and hair thoroughly with soap and water. Third, seek shelter, preferably in a basement or the center of a building, away from doors and windows. Fourth, Stay informed by tuning into official news sources for instructions. And most importantly, as we've emphasized throughout this video, get medical attention immediately and be prepared to report all of your symptoms, no matter how minor they seem. For more detailed information and guidance, please turn to trusted and reputable sites such as Modern Warrior Project and others. Organizations like the Centers for Disease Control and Prevention, the World Health Organization, and your local or national emergency management agencies may provide reliable information that can help you prepare and respond correctly as well. Avoid misinformation and rely on your instincts and research of the surrounding situation and influences that may be in play. Knowledge is power, and being prepared can significantly reduce fear and improve outcomes in an emergency. Take the time to look up the resources in your specific area so you know where to turn for credible updates and instructions. I know this topic can be anxiety-inducing, but the goal here is not to scare you, but to empower you with knowledge. Understanding the risks and knowing the right steps to take can make all the difference. By being prepared and informed, you can face even the most daunting situations with a greater sense of control and confidence. Stay safe, stay healthy, and as always, we'll see you in the next video.